Hi, everyone. Thank you and joining us for today's Direct Supply webinar. My name is Liz Jensen, and the title of our topic today is Making Space for Your Own Development. And I'm so thrilled to have all of you joining us today. As a reminder, this webinar is intended to provide general information, but not legal advice. So I'm so thrilled we have three great experts today joining us, and I'm so honored to introduce them. Our first panelist today is Aysha Kuhlor. Aysha has served as Chief Nursing Officer for several post-acute care organizations on the island of Hawaii and North America. Ms. Kuhlor is an accomplished healthcare nurse executive in the post-acute care continuum with a focus in long-term care. In the last 20 years, she has served in various leadership roles and on advisory boards for multiple organizations and nursing homes. Aysha holds a Master's of Science in Nursing from Walden University, and she currently serves as Chief Clinical Advisor for the Institute of Post-Acute Care, an organization focused on post-acute care staff education and competency-based certifications. Our next panelist today is Dr. Sara Elizabeth Hamm. Sara joined Lifespace Communities as the Vice President of Clinical Services for Lifespace. And over the years, her role has evolved into serving as Senior VP of Successful Aging and Health Services, and now today as the Chief Clinical and Public Health Officer. Sara is responsible for providing strategic vision and leadership for all clinical and resident care programs in their skilled nursing and rehabilitation centers, assisted living, independent living, and memory care programs. Sara holds a Bachelor's of Nursing from Marquette University and a Master's in Educational Psychology and Community Counseling from UW-Madison. And she earned a Doctorate of Nursing Practice degree in Executive Leadership from Loyola University. And our final presenter and panelist today is Tony Costa. Tony is Chief Nursing Officer at Ablehearts. He is a transformational nurse executive with over 25 years experience. He has a successful track record of improving patient outcomes across the continuum of care by focusing on high reliability through continuous improvement, clinical, quality, patient safety, financial stewardship, and service excellence. Tony co-chairs the Nurse Executive Council, an industry network of over 100 nurse executives with multi-site skilled nursing responsibilities. He holds a Bachelor of Science in Nursing from the University of Massachusetts and a Master's in Business Administration and Healthcare from George Washington University. We're thrilled to have all of you join us today on today's panel. So as we get started today, before we move into the questions from our panelists, I wanted to share just a little bit of background on kind of what kind of informed our desire to offer this session today, and a little bit of background on what we know about nurse executives' roles in the long-term care and post-acute care settings today. As we look at the role of nurse executives and the role that they play here, my experience as a nursing executive in long-term care has included many opportunities to develop relationships with other nursing executives, leaders who are experts beyond care delivery, workforce issues, regulatory compliance, risk management, operational issues, all are within the domain of their expertise. These are senior care experts with perhaps that most important of responsibilities, the delivery of care and services to vulnerable aging adults. Porter O'Grady, who's a nurse researcher in the field of innovation, describes the role of nursing executives as, quote, the most important factor influencing the context, culture, and care in nursing organizations. The American Organization of Nurse Executives and Leaders states that nurse executives set the vision for nursing practice in the delivery of safe, timely, efficient, equitable, and patient-centered care. Working within a collaborative and interprofessional environment, the nurse executive in executive practice is influential in delivering the patient experience of care, including quality and satisfaction, improving the health of populations, and reducing the per capita cost of healthcare. We don't speak enough about the role that nurse executives play in our space, and it is interesting, and that's part of what inspired us to offer this webinar today. There's not a lot of research and data that helps us understand who nurse executives in the long-term post-acute care space and assisted living space, what these nurses look like and what really informs their practice. In some recent research that I completed, this is some information and some demographic information that I thought I'd be interested to share. I did a study with 44 nurse executives in both long-term post-acute care and long-term services and supports, which includes assisted living, independent living, and home health. From the CNOs that I sampled, you can see here that there were variations in educational preparation are present. Almost 32% hold a bachelor's degree in nursing, and this was the most reported degree attained by nurse executives. 45% hold some type of an advanced degree, either in nursing or in another field. 6 of the CNOs that participated in the survey reported having an associate's degree in nursing, and 3 reported having a doctoral degree. About 43% of CNOs reported having 5 to 10 years of experience in their current role as a CNO. 5 reported having 10 to 15 years experience, and 5 had 15 to 20 years of experience, and actually 9 or more with 20 or more years of experience. So it was really interesting to see that wide variation of experience and educational backgrounds in the nurse executives that work in our post-acute and long-term care space. So with that kind of as the background to our conversation today, we're going to talk to our panelists, and we're going to talk through a few different questions. And I'm hoping that by the end of the session today that you'll come away with some new insights and ideas around how to make space for your own development and how to really focus on thinking about yourself as well as you're thinking about supporting your teams too. Okay, so let's get started with our panel. And first question today will be, let's just talk a little bit about your role. Tony, I'd like to start with you. Can you talk a little bit about how you came into the role that you're in today, how you developed, the knowledge and experience that you bring to your role today, and a little bit about your education and the support that you've received in the development as a nurse executive?
Yeah, I'd be absolutely happy to. So thank you, everybody, for joining us today. As Liz mentioned a moment ago, my name is Tony Costa. I'm the current Chief Nursing Officer at Ablehearts. And, my career started right out of nursing school. And I thought I wanted to do pediatrics. And so I went to Shriners Children's Hospital. And it was during a time unlike today when there was no nursing shortage. In fact, it was when hospitals would tell you to go down the street and get some experience at a nursing home and come back in a couple of years. And that's what happened to me. So I ended up, instead of going into pediatrics like I thought I wanted to, I ended up going down to that nursing home down the street and fell in love with the work that I did, the population I cared for, and the group of people that I was working alongside. I'm just really seeing their dedication and passion. And 25 years later, I haven't left. And so I grew professionally with that organization over a number of years. I ended up doing staff development, infection control, which was such a great role because I read every single policy. As a floor nurse, you don't get to do that. But in a staff development role, I got to read every single policy and know exactly what we were supposed to be doing so that I could teach it. So that was really great. And in that role, I also got to be more conversant with our regional nurse, and I saw what she was doing, and I was like, I want to be her when I grow up. And so she was probably my first mentor as a nurse, and we had a number of good conversations. And when she asked what I want to do as a nurse, I said, I want to do what you do. And she said, well, then you have to be a DON, because if you want to be a consultant and support DONs, you have to have walked in their shoes. So I became a DON. And then after a few years doing that, I had the chance to become a regional nurse, which I was very excited about. When I became a regional nurse, I was asked to take on an assignment that was in a different state. I'd always worked in Massachusetts. It's where I grew up. I was asked to go support buildings in Connecticut, which was something new for me. It was something that was definitely outside of my comfort zone. But I thought it was a great opportunity. So I went and I did it. I felt I was successful in that role down in Connecticut, because as our company grew, I was promoted to support centers, 40 centers across all of Southern New England, across several states. And as the company continued to grow, they asked if I would move out to California to be the vice president of clinical operations for their new West Coast operations. Again, outside of my comfort zone, I grew up in New England. So the idea of moving across the country, living somewhere that I had never lived before without my personal network or professional network was certainly nerve-wracking. But I said I want to grow, and so I did it. And it was really one of the best experiences for me, both personally and professionally. I think it's those opportunities when you're forced outside of your comfort zone, or you choose, I should say, to operate outside your comfort zone, where we really grow, both personally and professionally. And that was true for me, both in both those instances. In that role, I knew I wanted to be a chief nursing officer. And again, I had another mentor in that time in my life, and she was fantastic. And we talked quite a bit. And when an opportunity came up for me to be a chief nursing officer back on the East Coast, I relocated back out there, was a chief nursing officer for a company that after 6 months was no longer around. And it was a very challenging period of time in my career. But again, growth comes in those times where you're challenged. And so I look back at that period of my career, and I learned a lot. And I now know mistakes that I made that I wouldn't make again because of it. So, and then I worked for an organization out of Atlanta as their chief nursing officer for the last 2 years, and then came to Ablehearts back in August. So I'm very excited to be here. Liz, one of the questions that you asked besides experience was really, how do you develop that knowledge and that experience? And so for me, I really think it was, two of those things. One, it was the mentors in my career. I've always had, for most of my career, someone who I looked up to professionally and who provided me really good guidance, whether it was, what I needed to do to become a regional nurse, what I needed to do, in order to become a CNO. In fact, I had a conversation with my CNO when I was thinking about going back to school. I had already gotten my bachelor's in nursing. I was thinking of going back to get my master's in nursing, but I was also like, maybe I want to get my MBA. And I was kind of torn between the two. And so set up some time to meet with my CNO. And, she said to me, she was like, I sit in that boardroom, and I'm the only woman at the table. I'm the only nurse at the table. And she goes, in retrospect, she goes, I wish I got my MBA, because I feel like a lot of people around that boardroom table had an MBA or some type of degree in finance. And if I had that along with being a nurse, I may have not had to have worked so hard to be respected for my opinion on financial matters. And so I decided to get my MBA for that reason, instead of pursuing my master's in nursing at the time. I have to say, I was glad with that decision. I remain I'm happy about that decision, that I did that. So I would say those for me are some of the key things. Grow outside of your comfort zone, know who your mentors are, really spend some time with them, and seek out those experiences and exposures that are offered to you.
Yeah, Tony, thank you so much. That whole concept, right, of having mentors, but then also understanding the role that you're in, and what's kind of needed, for yourself to develop in that particular space. And so that's awesome. Thank you so much. Aysha, let's go to you next if we can. I'd love to hear a little bit from you about how you came into your role, and really how you developed your background, your education, your experience as well. And maybe you can share with us a little bit more about how this kind of brought you to where you are today then too.
Absolutely. Thanks again for inviting us to speak on this very important topic. As Liz mentioned, I currently serve as the Chief Clinical Officer for the Institute of Post-Acute Care. The Institute is the leading organization for post-acute care education, as well as certification programs. In my current position, I'm responsible for identifying training gaps, developing clinical policies and procedures, and working through the regulatory maze to develop programs and services to meet the needs of our post-acute care clients. I have been in nursing for approximately 25 years. I started in acute care setting as a telemetry ICU nurse and then transitioned to long-term care. Within months of working on the floor as a charge nurse, I was asked to take on a temporary supervisor position. 2 months into the position, I realized I was in it for the long haul since the administrator had difficulty recruiting a nurse and kept asking me to extend one additional month. I'm sure most of you on this call have had similar experiences where you were asked to cover a position for a short period of time but ended up permanently in that position. This is what I call baptism by fire. After my supervisory position, I went on to become a DON regional nurse, and most recently, Chief Nursing Officer for the largest post-acute care organization in Hawaii, and also Chief Nursing Officer, VP of Clinical Operations for a large nursing home chain on the East Coast. So to answer your question, how I ended up in these roles, I think I was at the right place at the right time through friends and colleague recommendations and referrals, or bosses who just believed in me and encouraged me to take on such roles. Developing my knowledge and experience, I would say once in that CNO role, and being challenged on several locations in boardrooms about budgets, forecasting, financial planning, fiscal management, to name a few, it quickly became evident to me that in addition to my experience and nursing degree, I also lacked the knowledge and expertise required to excel in the role of the nurse executive. So recognizing this deficit, I set out to become a lifelong learner. I have and continue to pursue leadership programs that offer CEUs. I serve as faculty and mentor for our nurse leaders, directors of nurses. I do a lot of teaching, and with teaching comes research and utilization of evidence-based resources to guide clinical practice. I am very intentional in selecting and serving on association boards that foster my professional growth, as well as help me stay abreast with changes and trends in the post-acute care space. Developing my knowledge and experience has also been through collaboration with peers in the industry by attending state and national conferences, as well as events. All of this has been extremely invaluable. um, Liz, to answer the last portion of your question about additional education to support my development as a nurse executive, I would have to say, aside from my nursing degree and my recent certification as a nurse executive, there were no formal programs to support my professional development as a nurse executive. I researched several programs, hoping to find a program for nurse executives in long-term care, but unfortunately, none existed. So what I discovered were programs developed more for our acute care executives and colleagues, and identifying this gap after an extensive market analysis is what helped me, as well as the team at the Institute of Post-Acute Care, develop a nurse executive education as well as certification course. I wish I had the benefit of such a program prior to taking on a regional or chief nurse executive role.
Yeah, Aysha, thank you so much for sharing all that. And I think as I listen to you talk, I think too about the adaptability and the entrepreneurial, spirit. I think that kind of has come through you and into the work that you're doing as well in creating new opportunities for other nurses to learn and to develop. And you're right. In preparation for this, we did talk about how there isn't really a place for nurse executives in our space to really go to be able to seek that out, like there are, I think, in the acute care space. And so, supporting each other and working on new projects like you're working on with the INSPAC group, I think is really important and helpful in helping other nurses, and then the nurses who are coming up, have a path and a program to follow as well. Thank you. Sara, let's hear from you. I'd love to, you and I have known each other for many years, and it's been just such a thrill to kind of watch your career develop over the years as well. Tell us a little bit about your role and kind of your background and how you came into your role, and maybe a little bit more too about your doctoral work.
Certainly. And it's an absolute honor to be with you today. Liz tells us we have over 130 participants on the call today. So we're really thrilled to be sharing our experience with you. My passion for senior living and post-acute care is really embedded in my DNA. My mother, Elizabeth, just died on Valentine's Day, and she has been my greatest hero and role model, not only personally, but professionally. And my mother was a long-term care director of nursing and administrator and an executive director, and really started in the 1960s when I was a small child. And when I was about 2 years old, she took me by the hand and would bring me to work with her. And I just developed this incredible passion for working with aging adults that has remained with me throughout this day. And at that point in time, it was really interesting because in the United States, we only had the very, very traditional skilled nursing and rehab nursing homes. We did not have assisted living, memory care. There weren't a lot of independent living communities or continuing care retirement communities. So it's been really wonderful to see the evolution of healthcare since I started in the 1960s and 70s. And for the young nurses on the call, I still remember, you could walk through the nursing home and everyone was in a locked posy restraint, or they had vest restraints on. If there were behavioral issues, we were giving out Haldol and Mellaril like candy. I mean, the use of antipsychotics was horrible. We were feeding residents pureed diets through feeding tubes, and you would never, feeding syringes, not feeding tubes. So clearly, those are things we would never see in a skilled nursing and rehab community today. So it really has been exciting. But when I was a child, believe it or not, in grade school and high school, I worked as a candy striper until I was about 16 years old. And then I became a housekeeper in the nursing home where my mother worked, and very, very quickly realized I wanted to be a nursing assistant. And those were the days long before we had training for certified nursing assistants. So my first day on the job, they basically handed me a posy restraint key, and they had me shadow another nursing assistant, and that was my formal training. And I remember working on the Medicare program, and I usually had 30 to 40 residents by myself on the evening shift. So times certainly have changed. But after becoming a nursing assistant at 18 years old, I went to a licensed practical nursing school in Milwaukee. And then I just kept jumping into additional programs. I went on to get my associate degree in nursing. And then I went back to Marquette University to finish my BSN. And then right after I finished my BSN, I started at Marquette in their master's program in nursing administration. And sadly was really disillusioned by that program. And I happened to take one elective course in the School of Counseling Psychology. And it was men and women of all different ages from all different disciplines. And I absolutely fell in love with the psychology curriculum, which was not only counseling psychology, it was educational psychology. So I switched from the School of Nursing, and that was probably one of the best decisions that I made. So I do agree with Aysha and Tony that if you are going to pursue continuing education, don't just automatically lock yourself into a master's in nursing. And I'll tell you a really funny story about how things have evolved. I was signing up for my very, very first master's classes in the nursing administration program at Marquette. And each of us had to meet with the dean of the School of Nursing, who happened to be an elderly Catholic nun. And the woman in front of me was explaining to the dean of nursing that she wanted to have a dual degree. She wanted to have an MBA and a master's degree in nursing. And this was in the early 1980s. And I remember the dean of nursing screaming at her and saying, "You are a registered nurse. You are not a businesswoman. So if you want to go to the School of Nursing, get out of here." And I remember I was very young at the time and I was so shocked. But I'll talk a little bit more in my presentation how I really, really wish I would have had more finance and accounting and develop more of those operational skills that we need to have as healthcare executives. So after 20 years of having a master's degree, and I was already in my late 50s, I went back to Loyola University to pursue my DNP. And for any of you who are interested in pursuing a doctorate level degree in nursing, I really, really encourage you to do so. Liz and I have both had such rich, wonderful experiences, and I really did a lot of research. I knew that I did not want to be an academician and teach at the university level. I knew that I did not want to spend the rest of my career doing nursing research. So I elected to do a DNP in executive leadership. And that was one of the only universities that had a really strong program that offered nurses a doctoral degree in executive leadership. And it was an absolutely amazing experience. Although I am sad to tell you, we started out in the DN program with about, I would say, 70 nurse practitioners who already had master's degrees, who were in the doctoral program to advance their nurse practitioner degrees. And there were only about 11 or 12 of us in the DNP Executive Leadership Program, which was a postmaster's program. I was the only nurse from senior living or post-acute care. We had maybe one person from home health, but we had the head of the program at UCLA. We had, nurses who were running the VA hospital system. So it was really wonderful because I was able to teach them a lot about senior living and post-acute care, and they were really able to teach me a lot about their practice areas. But for me, it was important that the DNP offers that degree for individuals who really want to be clinical scholars, and the PhD in nursing is really tailored for individuals who want to be academic and research scholars. So that was really the only reason, because most of my career I have been a nurse executive. I haven't been a nurse practitioner, haven't done a lot of hands-on clinical practice in many years. Yet again, I knew that I did not want to end my career teaching in a college or university. So like the rest of the panelists, I had progressive roles in post-acute care. Nursing assistant, LPN, RN, nursing supervisor, staff development coordinator, infection control coordinator, assistant director of nursing. And then when I was 26 years old, I was offered a director of nursing position for a very, very large publicly traded company. And it was their flagship in one of their largest buildings in Wisconsin. It was a highly subacute community that had about 250 beds. And the day that I walked in the front door, the administrator was walking out and he said, "Welcome, we're so happy you're here. Here are the keys. Here's the 2567. We just got the results of our annual survey. And if you would please write the plan of correction and send it in, I'd be ever so grateful. And I'll be back from Jamaica in 10 days. So that was my orientation for my first DON role at the age of 26. And like Tony, I was only in that role was probably 6 to 9 months. And the corporation approached me about becoming a regional nurse. So that's really where the executive leadership started. And I had been a regional nurse for a couple of different companies. And then one of those companies promoted me into the vice president of clinical services role back in the 1990s. So I have served in a number of different executive leadership roles, and I've learned from every one of them. In regard to, how I've learned, I really agree with the other panelists. It is wonderful, wonderful nurses, physicians, and healthcare professionals who really nurtured and mentored me. They recognized early on that I loved leadership. I loved working with people and leading people. I've always loved education, and I think that's one of the key attributes of a really strong leader. But I will also tell you some of the very best lessons I've learned are from the worst managers and nurses I have ever worked with. And I think that probably resonates with most of you. I have actually been a victim of lateral violence and bullying throughout my early career. I remember being a nursing assistant and, young BSN graduates saying, I didn't go to school to give a bedpan, that's your role. And even when I was an LPN, I was so proud to finally be a nurse. And I would have, these well-meaning intended nurses say, well, you're only an LPN, you're not a real nurse. And I mean, that just cut me to the core. So throughout my career, I have really, really tried to inspire and encourage others that we all play a very, very critical role in the healthcare system, regardless of the initials that you have before, actually after your name. So it is really critical that for each of us, we're thinking about mentoring and succession planning. I was also very, very deliberate in my later career about working for companies who really embrace lifelong learning. That was really important to me, that they supported education and training. And I was working full time. Every time I went back to school, I had to work full time. So I was also going to school full time. And if I had not had the support of my colleagues and my leaders, I never would be where I am today. Even when I was working full-time at Lifespace, I was doing my doctorate program full-time, and it almost killed me. But they were so supportive, and we offer a lot of scholarship programs. I won a couple of scholarships through Nadana and Pharmerica. I mean, there were many, many individuals who supported and mentored me along the way. The one thing I will say about education is that if you are going to pursue a master's degree and certainly a doctorate, please do your due diligence and make sure you research the programs. There are a lot of unaccredited programs out there where you can basically go online and pay for a degree. And those programs have no credibility. It was really important to me that I went to a bricks and mortar university, and I went to a combined program that was partially live online classes, which even Harvard has now, but we were also required to go to that campus so that we could interact with our cohorts and professors. But really want everyone to be careful to make sure that you're going through an accredited program and that you're going to get your money's worth for your education. So thanks, Liz.
Sara, thank you so much. Thank you. It's so interesting hearing all three of you and the different paths that each of you have taken along the way, right? I mean, I think that's one of the remarkable things about being a nurse in general is the opportunities to really practice in lots of different areas. But there seems to be something special, I think, about the path that nurse execs in the long-term post-acute and assisted living spaces really take. That seems a little different, I think, from some of the paths that those in the acute care space, that some of the nursing leaders that I know in that space that have taken maybe a more traditional route through, the hospital development and support through that. So it's so great to hear each of your journeys and the support that you have found and looked for along the way. All right, we're going to shift gears just a little bit because I want to talk a little bit about, and I'd like to hear your thoughts and just share. There's been so much that's happened over the last few years, in particular with the pandemic. And it's brought such unprecedented change to our sector, and also a new level of scrutiny. As a result, many nursing leaders have found themselves mired in regulatory changes, meeting government requirements, and then just this massive workforce crisis that we're dealing with, all while experiencing just so much loss of life of staff, loss of life of residents, our own family members that we've lost along the way. I'd like to hear from each of you, and Aysha, we'll start with you. Can you share a little bit about what you've done as a nursing executive, how you think about managing so much change so rapidly, and how that's either changed or impacted how you're thinking about your own development, for the future? What are the things that you think are really critical or important as you think about the future? And Aysha, let's start with you.
Sure, Liz. We continue to feel the impact from the pandemic. Nursing leadership, to me, during the pandemic changed from managing from a distance to boots on the ground, so to speak. I recall very clearly working tirelessly with my team, writing mitigation plans for the pandemic, developing policies and procedures almost on a daily basis, anytime there was a new guidance from CDC or CMS. As nurse executives, we were tasked and relied upon by so many family and friends to save lives from this ravaging virus. And it was certainly not easy and very difficult for a lot of us. Through this experience, I think I speak for most of us by stating the pandemic has truly encouraged critical thinking, creativity, thinking out of the box, improved communication, collaboration, teamwork, and also appreciation for each other. Most of us were able to stay focused on the task at hand because there was just so many changes going on so rapidly that, unless you were focused, you would lose sight of what you were supposed to do. And also recognizing the importance of our own mental health for ourselves and our staff. I have to add that being a member of the nurse executive group was extremely helpful and continues to be helpful. It provided me and continues to be an invaluable resource for collaboration and sharing best practices. As you stated, the pandemic has been very challenging, and without a group such as the NEC, my colleagues, associations such as ACA, Leading Age, to name a few, navigating through the pandemic would have been almost impossible. So as I think about the future, I look at it with a completely different lens. Not knowing what tomorrow in healthcare could bring. I would say with the pandemic, I've learned to govern a little differently. In terms of education and services, we've looked at that in a very different way. Most of us, when we look at technology, we encouraged the use of telemedicine, something we didn't think we would probably see in our lifetime. For physician assessment and intake, we now focus a lot on virtual education, just as we are doing now. FaceTime for virtual visits. Whoever thought we would have a thing like that for families to do visits virtually, and working from home where applicable. So leveraging the technology as best as we could. I believe some of the lessons learned for me is to keep an open mind and research how new healthcare technologies can help bridge the staffing gap for our healthcare workers.
Aysha, thank you. When you said to keep an open mind, right? I think certainly I would agree with that. There was so much we were challenged with to have to, think about and or come to grips with, or just recognize where we needed to step in as nursing leaders. and who needed help with what. I found myself evaluating countless KN95 masks and N95 masks, and just trying to help bring some guidance to that space, and which was something that we hadn't ever had to deal with before either. So thank you for sharing all that. Sara, I'd love to hear from you a little bit. If you can talk a little bit about just your, how you kind of navigated these last few years and what you're kind of looking to for the future.
Absolutely. And I completely agree with Aysha. It's quite frankly a little surprising to me that this is the first global pandemic that any of us have had to handle within our lifetimes, given the last global pandemic was in the early 1900s. This was our first. It likely won't be the last. And certainly as nurses, we're used to multitasking and we're used to dealing with trauma, no matter what practice setting you work in. But I think nurse executives and leaders have really, really learned the value of resilience and resiliency. It's absolutely critical as a leader that you embrace change and you lead your team members through change management. I'm sure, like the rest of you, my team was writing and rewriting policies sometimes 5 times a week because of the disparity in the local, state, and federal regulations, which was ridiculous and created a lot of extra work, especially in post-acute care, where we had such bold restrictions on caring for residents and certainly for visitation. So that was very difficult to lead the teams through, and also to lead residents and families through. You think about it, it's really only been the last few months in our skilled nursing health centers that residents have been able to see the smiling faces of their family members and team members. We've not been through a trauma like that in my career that has had such a profound impact on psychosocial well-being. So it's not only taking care of our residents and patients from a clinical and a physical perspective, it's the emotional care and trying to keep their emotional well-being at optimal levels. I think compassion fatigue has had a huge impact on our profession. We had very, very low turnover rates of less than 18% for our organization. And we lost long-term nurses and nursing assistants. And a lot of that was because of the psychological burden. Also, think about how many of your team members were working double shifts and overtime. I had to be very, very protective about our nursing leaders, not allowing the director of nursing to work the day shift and then come back and work the night shift, not allowing the organization to use my regional nurses as directors of nursing and hands-on caregivers. I really needed them to help me run the pandemic program. So certainly you have to be graceful in your communication, but there were also times I had to say, no, we're not going to do this. It's not safe, and this is not a good use of our resources. So one of the things I will say for any of you who are interested in leadership roles is that a nurse leader who cannot adapt to the dynamic changes that are or occurring in healthcare today, they're not going to be effective. I learned many, many years ago when I was working for a very large publicly traded skilled nursing company that had we'd bring on 200 buildings and then we'd divest 50. You have to buckle your seatbelt for the ride, and you really, really learn from both good and bad experiences. And that's really a part of building resiliency, trying not to get frustrated. So even the emotional support that I was giving our DONs and our leaders in the health centers, as well as my own clinical and health services team, was very essential. I absolutely insisted that my team members really practiced a healthy work-life balance. I made my team members take time off, take vacation. We covered for one another. I told them, don't you dare take your cell phone or open your laptop. And, just taking care of the physical and mental health of the own leaders on our own leaders on our teams is very, very critical to retention and reducing that turnover. So I would say those are some of the most important things, making sure that team members had a healthy work-life balance so that they stayed physically and emotionally well. And then really working with operations and our HR partners to really fill positions and do creative things to, as much as possible, reduce and eliminate the risks of external agency use. My company previously used like zero or very, very little agency use. And like most healthcare providers, I mean, we had to reach out to agencies, and that can be a real risk to your organization when you have different nurses and nursing assistants coming into your health centers, you know, every single day. So we really partnered as a team to make sure that we had healthy staffing levels and that we were doing what we needed to do to fill those staffing gaps.
Mm-hmm. Yeah. Sara, thank you so much. I love that, buckle your seatbelt, because wasn't that the truth for sure.
Yes.
Tony, let's hear from you. I'd love to hear kind of your experiences in the last couple of years and how, as a nursing leader, how you've kind of are thinking about the future.
Yeah, no, thank you, Liz. I think our operational and financial colleagues prior to the pandemic always said that nursing was important, right? I think the pandemic really showed to them why nursing was so important. And I think it gave a different level of respect within organizations for the role of nursing and for the role of the nurse executive as well in the organization. I think that's allowed us to have conversations that previously may have been shut down, especially when it came to things that were associated with spending money, right? And so I think over the last few years, some of the things that I've really been focused on has been around looking at care models. We've been very traditional at times around how we staff our buildings. We don't have enough bodies today, right? Whether it's RNs, LPNs, CNAs, we just don't have enough bodies. So how can we do things differently in our centers? And so, for example, I'm looking at med techs in states where med techs are allowed. And if we do that, then what is the role of the nurse? If they're spending most of their time on the med cart today, and now all of a sudden they don't have to, what are they doing, right? And so trying to relook at and reimagine what a nursing staffing pattern can look like in today's day and age with limited staffing. So I think that's an area that we've been focused on. Another area, again, around staffing is for the staff that we do have, how do we make their jobs more efficient? And I think this is where, the technology and innovation and investment can really come in, whether that's looking at vital sign machines that integrate directly to PCC to take away the data entry on the part of the clinician. That only saves a few minutes, but a few minutes add up, right, over the course of a shift. Looking at efficiencies around MedPass. Prior to the pandemic, a lot of us were working on med reductions, right? We were working on BID MedPass. Where did those things go, right? Well, they disappeared during the pandemic, but we need to bring them back out because those are time-saving opportunities for our staff. We've started to look at, from a data perspective, at patients on certain number of meds, right? We've always used 9 or more. Now we're looking at 20 or more because so many of our patients are on that many meds, right? And so, and working with our providers to reduce those medication counts and thus reduce MedPass and make our staff more efficient. Looking at blood sugar checks. We have so many patients today that are still getting routine blood sugar checks in our setting, which really isn't necessary if we're doing good diabetes control with current evidence-based practices. Again, that's a very time-consuming task for our staff. So some simple things that we can look at in order to make our staff more efficient. I think the third area, Liz, for us has really been a focus on the people, right? We know that our staff are our most valuable resource. We've always said it, but now we really have to mean it because if we're not treating them like our most valuable resource, they're going to go somewhere else, right? To that agency that's going to pay them a lot more money. So we've worked on increasing our DON support by having smaller regional nurse assignments, having a full-time infection preventionist in every one of our buildings. Certification programs for our DONs, like through NADANA, for our IPs, and for our wound care nurses, getting them wound care certified, not only to recognize them, but also to increase the competence of folks in those roles within our centers. And then looking at career development initiatives. How do we partner with some of our schools in the area, whether that's CNA training programs, colleges and universities, scholarship opportunities, in order to have a plan for our staff and so that we know for each of our staff, what do they want to do when they grow up in their career, that we meet with each and every one of them, and that we have a plan to help them get there through the partnerships and financial opportunities that we've been able to put together to help our staff continue to grow. So those are some of the things that we've been trying to do differently in order to manage a lot of the change that we're seeing, particularly around staffing at this point.
Yeah. Wow, Tony, thank you. As you were talking, I was thinking the devil is really in the details, right? Like, and over the years where I know in my career, where we focused on kind of back to basics, or, you reevaluating just even that core care delivery model, and is it matching with current evidence-based practice, is not something we should ever take for granted, because there's always those opportunities to come back and revisit better ways to do the things we have to do every day. So thank you for sharing that. It was really, really great. Thank you. Okay, good. Well, I think we have time for, we're going to take one more kind of round question for the panel, and then we want to make sure we save a little bit of time at the end. I know we've had a few questions come through the chat. So I'm going to start, actually, Sara, with you for this final question. Is just, how are you thinking about your own development going forward? I was joking with my husband, when I finished my PhD, like, it's considered a terminal degree, right? And it sounds so final, but how are you thinking about, now that you have a terminal degree, how are you thinking about your kind of growth going forward? And how do you think about your own development going forward?
For me, as I said earlier, I really, really believe in lifelong learning. And I think it helps all of us with the aging process. There's always something new to learn and grow. And right now, part of my role as the Chief Clinical and Public Health Officer is clinical risk management. I do the infection control, clinical operations, legal and clinical compliance. So I love risk management, and I'm getting certified in risk management. And because I also love the legal aspects of nursing practice, I'm getting certified as a legal nurse consultant, just to really increase my knowledge in that area of healthcare, because inevitably everyone on this call has dealt with a very, very serious resident, patient, or team member incident or injury. And it's really important that we can lead our teams competently through those types of adverse events. So that's something that's of great interest to me. I'm also one of the nurses who's heading into the last phase of my career. I will likely be retiring in the next 3 to 5 years. So I'm very, very invested in succession planning. And I can tell you, I have been really doing promotion of internal candidates who have a great deal of strength and competency. I have the strongest team I've ever worked with in healthcare, and I very deliberately hired nurses with very, very different skills and talents. And if I was hit by a Mack truck today, I have at least 2 to 3 people who could step into my position. And that's going to be my greatest joy when I do decide to retire, that we will have internally prepared candidates who are really ready to step into my role. So that's been a big part of my career the last few years. As far as what I wish I would have had more of throughout my nursing career, and I think this is valuable to anyone on the call who really wants to become a healthcare executive and a nursing leader, definitely more on the business operations side, taking classes so you really understand finance and accounting. I remember the first time when I was 26 years old and the administrator threw the profit and loss statement in front of me, I completely freaked out. I had a hard time balancing my checkbook at that time. I certainly had never evaluated a P&L statement. And now a lot of what I do is, financial in nature. And we can't deny that as nurses. If you look at nursing labor in hospitals and senior living and post-acute care communities, that's the biggest piggy bank. So you really not only have to be nurse leaders, you have to be business leaders, and you will be much, much more valuable to your CEO and your operations team, and you'll have many, many more opportunities for professional growth and development if you are really a well-rounded nurse. And just as Tony said, getting an MBA that's a wonderful thing for a nurse to pursue. So those are some of the recommendations that I would have. And lastly, Liz, if I can just say this, I know that most of the participants on the call are nurses, but even as you are developing your teams and promoting individuals, it's very, very important for you to know that the best clinicians are not always the best nurse executives and leaders. And sometimes they love the clinical practice of nursing and they do not want to lead others and manage others. So it's very, very important. You're not just looking at clinical competency, that you're really looking at a full spectrum of leadership competencies as you are building your own leadership team.
Yeah, that's such excellent advice, Sara. Thank you for sharing that. And I couldn't agree with you more. I think those opportunities to continue to grow yourself. But thanks too for sharing about the succession planning and being intentional about that, which I think is so critical. Tony, let's hear from you. I'd love to hear your thoughts on kind of the same question around kind of what comes next for your own development.
Yeah, absolutely. So, I think we talked a lot today about higher education. And, when I think about growth, I think of it in, 3 different ways that can be supported. And that's education, exposure, and experience. And, for me at this point in my career, when I think about education, it's something as simple as reading nursing journals, right? Who has time for that? We have to make time for it. So for me, that's an area that I really try to focus on. I still get paper journals delivered to the house, and I make time to read them to stay up to date on research and evidence-based practice that's happening in our area of healthcare. So for me, that's how education is really important. I think I talked earlier about putting yourself out there and challenging yourself. I think we all know what makes us the most nervous that we might have to do, whether that's meeting with a health department, whether that's having to get on a webinar and present to people that you don't know and 130 people you can't see. There's things that make us all nervous. And so what are those things for you? I know what they are for me. Again, one of them is presenting like I am today. And put yourself out there and do those things because, again, that's how we grow. And so for me, that's what I'm really focused on is really those experiences, exposure to different people, different organizations, different ways of thinking about things, finding those opportunities, and then continuing my education really through routine, reading of what's going on out in the research and evidence that impacts our field.
I love that, Tony, so much. The 3 E's: experience, exposure, education. I'm going to write that down. I'm going to put that on my desk. I love that. That's great. All right, we're going to turn it over to Aysha at this point. And Aysha, I'm going to ask you to maybe talk a little bit about the same things that the prior panelists did. But if we've got a couple slides we're going to share as well. And I know you have some information you want to share with us around the INSPAC process as well. So I'm going to turn it over to you for these final minutes.
Absolutely. Throughout this presentation, we've talked about, making room for your own development. And I do that by making sure that I involve myself in organizations and associations. I belong to the American Nurses Association, ACA Leading Age, the National Black Nurses Association, just to name a few, because these organizations provide resources to promote my own leadership development. As Sara mentioned, there's the need for due diligence. The question about additional education and certification, there's definitely the need for due diligence for nurses seeking to advance their degrees, when they're looking to take an MSN or a doctoral program. As nurses, as most of us mentioned on the call, we worked different roles prior to landing in these executive positions. With nursing leadership, it's very challenging to juggle a full-time job, family obligations, go back to school full-time. Once my master's degree was done, I knew that, I needed to still be in executive leadership programs or positions, but I knew that I also didn't have the time to go back to school. So I'm currently a post-acute care certified nurse executive through the Institute of Post-Acute Care. And I chose this program because it's evidence-based, it's peer-reviewed, And it has also been approved for continuing education units by the New York University Rory Myers College for Nursing Continuing Professional Development. And the college is an approved provider of ANCC credits. So when Sara talked about validating a program, certainly the INSPAC programs have all been validated. Prior to this role, I wish I had more training, like Sara and Tony said, around strategic planning, fiscal management, as well as dealing with some of the politics in the corporate environment. Again, through a market research that we completed 3 years ago, it was identified that nurse executives in the post-acute care environment have no resources for additional education compared to our acute care partners. So I am proud to say that at INSPAC, we have been able to close this gap by providing robust evidence-based post-acute care education and certification programs. And the goal is to be a resource for aspiring nurse leaders and executives interested in leadership roles, such as a DON, Regional Director of Clinical Operations, VP of Clinical Operations, CNO, to name a few. Our programs have been adopted by the post-acute care organization. Sara mentioned succession planning as part of a succession planning program. I'm sure Liz will share additional information with you once we get the call. But I will highly encourage current, future, aspiring nurse leaders and nurse executives to make room for your own development by considering additional certification and education programs from accredited programs and doing due diligence before you take on these programs. So again, Liz, thank you so much for inviting us to be part of this very important discussion. I truly enjoyed it.
Oh, thank you so much, Aysha. And a huge thank you to all of our panelists for their expertise. We're just so humbled to have you all here with us today. So thank you.